I'm Alice Hart-Davis, and this week's Tweak of the Week is an Ultherapy brow lift. Now, Ultherapy is an energy treatment that uses focused ultrasound waves to lift and tighten the skin, and I've come to the Cosmetic Skin Clinic in central London to try it out. So come along with me, we'll see how it goes. So I'm at the Cosmetic Skin Clinic with Dr. Tracy Mountford, who is the founder, and we're great pals, but sitting at a slight distance because of the situation now. And I wanted to ask the basics about Ultherapy. Could you explain what Ultherapy is and how it works?
Ultherapy is a way of non-surgically tightening and lifting skin, and it uses micro-focused ultrasound to actually stimulate deep levels of collagen, to cause a remodeling, tightening, and thereby giving a nice lifted effect. So it's a very clever piece of technology, and when used well, can give really, really good results.
So the brow lift is the new unique thing because Cosmetic Skin Clinic has launched this treatment, and that's what I'm going to try. How does it work on the brow? What's different about it there?
Yeah, it's a really good, what we call really good entry point treatment, because it's like anything in life. Some people want to just try something and see how well it does for them. And a brow lift is easy to perform. It only takes 15 to 20 minutes. But why it's good is that it can do a number of things. It can improve the top eyelid. So where a patient may be just on the cusp of maybe thinking about maybe a surgical procedure for their eyelids, and of course at the end of the day they may end up needing to do that. But if there's a little bit of lid laxity, it's a really nice treatment to just give that little bit of support, thereby making the eyes look more fresh and more open. It can't overlift and it can't over tighten. So you can't get that sort of look. It just very, very naturally lifts the brow and thereby the upper lid.
One thing people always worry about with Ultherapy, apart from the discomfort, is that it's going to somehow melt their fat.
Yeah. I think this is the biggest thing we have to try and address with patients, because nowadays people do look online. I would. The micro-focused ultrasound is very clever. So what we do is we scan the surface of the skin. We have this screen where we can actually look and see all the layers of tissue. We can see the skin, we can see the muscle, we can see the fat. And if we do our job well, which we will do here, you can avoid hitting fat with this technology because it's under direct visualization.
Thank you, Tracy. I'm really looking forward to it.
Thank you.
Right, now for the treatment, I'm here with Helen, who is the clinical manager here and is the UK trainer for Ultherapy. So I'm in very good hands. And what's the first step when we do this treatment?
So the first thing we're going to do is assess your brow and the movement in the brow, and obviously the eyelid skin here, because we need to check that you're suitable for the treatment. So Ultherapy will target the muscle which is above the brow here, which causes the lift in the brow. So we're going to be focusing and putting the energy into this area here, and the idea is that it's going to stimulate the collagen as well, so that will cause some lift and elevation here. So we're just going to mark up the areas that we're going to treat and the areas that we're going to avoid. There's certain structures up on the brow here that we need to avoid during the treatment. So we're going to be targeting the muscle, but the muscle's quite shallow here. Okay, so we've marked up. We're going to be using an ultrasound gel, if you remember. We're firing thermal coagulation points down onto the muscle to cause some contraction and lift. I can also see the bone, I can see where the muscle is and exactly where I'm applying my coagulation points or heat. And it makes it a very individualised treatment as well, because we have to assess the depth of where your muscle is, etc., and where I need to be focusing the energy. We're talking about a pain score of 1 to 10. This is usually around a sort of 4 or 5. Sometimes a little bit pink on the skin afterwards, but that will resolve very quickly within about an hour or so. So this is a 1 session only treatment, and usually you start to see results first of all around 6 weeks, whether you get some skin improvement, and then you'll get your full tightening around the 3 to 4 month mark. And then usually people will repeat this treatment 12 to 18 months.
Okay, so I'm hoping for a bit of elevation of the eye.
Yep.
The elevation of the brow, which will open up the eye a bit. 6 weeks, 3 months, we'll see. Yeah, I know everybody says I rate it wrong on the pain scale and that maybe it should be a bit more than I'd say, but you know, I really think anybody could handle that. And that was really quick. That must have been 20 minutes?
Yeah, exactly.
Less. Yeah. So that was the Ultherapy brow lift. And you saw it was a little bit red on my face when I finished, but look, even now that's dropped right out. So there's no downtime as such. And yeah, there were a couple of uncomfortable pulses. You may have seen me wincing on there, but that was it, you know, so pain-wise it was absolutely fine. So I'm gonna wait a few weeks to see how this develops, and I'm looking forward to a little bit of lift, a little bit of open eyes, which would be a really nice result. So thank you very much for watching. I hope you enjoyed it.